Welcome back to Medlysis, everyone. I am Mansi Bhatia.
And I'm Kiwi Kolu. Today we have a truly special guest joining us.
That's right. We're thrilled to introduce Dr. Rahul Modi, a superstar in the world of orthopedic surgery. Not only is he a board certified MS orthopedic surgeon, but he also specializes in knee and shoulder surgeries with a special interest in sports medicine.
And it doesn't stop there. Dr. Modi is affiliated with FIFA and Olympics.
He also holds a diploma in sports medicine recognized by these major organizations. And did we mention he's a distinction holder and a gold medalist in MS Orthopedics?
We've got a lot to cover today. Dr. Modi, welcome to Medlysis. To start off, what are some things that the common person would be surprised to hear about your field?
Hi, hi, thanks for having me firstly. And I'm Dr. Rahul Modi, and I'm thrilled to be a part of your journey, and I'm thrilled to be here. So if I get the question correctly, what are some things that I see commonly in my daily practice? Is that right?
Yes.
Okay. So something that I very commonly see in my daily practice, and that happens because of sports injuries. It's very, very common now that sports awareness is also increasing. The ligament injuries are increasing quite a bit, and so the interesting thing is that a lot of knee ligament injuries require surgery, but 90 to 95% of ankle ligament injuries do not require surgery. So, that's something that everyone can take back from this sort of a lecture, that not all ligament injuries require surgery, and a lot of them can be treated non-operatively too.
Oh, that's amazing to hear, actually. We didn't know about this either, so that's something more we learned today. So, based on your experience working in this field in your country, what are some changes you would like to introduce to how things are run in this field in India?
So the good thing in India is that medical help is very, very easy to get. So you can just walk into a hospital and a specialist will see you. You will get an MRI done in the next 10 minutes if you require for these ligament injuries. You can get X-rays done in 5 minutes. So it's very easy to get yourself investigated and treated in India. The downfall is a lot of over investigations are being done. A lot of patients are being, because medical help is so easy, they take, say, 4 or 5 opinions for the same thing. And it adds to a lot of confusion in the patient's minds too, as to what is the right way to be done, because every surgeon, has their own opinion on how a particular injury needs to be treated. And in that, I think a lot of patients do suffer because they don't really know which one is the right, treatment for them. And they usually go with whatever feels better or whatever is easier to them, which may not always be the right thing to do. So that's how, having too much help at your disposal can be a double-edged sword. So that's something that is a little different from in our country as opposed to maybe say UK or Canada or someplace else.
Well, thank you so much for that detailed insight. Moving to a slightly different topic. Knowing that you were joining us today, we couldn't help but do our research on you. And what we found is that you've performed many orthopedic trauma cases and arthroscopies. So we can safely assume that these must be vital procedures in your field. Can you please explain these procedures and their importance for us?
Okay, so I am a sports trauma and arthroplasty surgeon. So I do a lot of arthroscopies, which are basically keyhole surgeries in which we use an arthroscope that is a camera, and we insert it inside the joint, and we do the surgery via a minimally invasive approach. Now, what this does is it reduces the post-operative pain, it helps faster recovery, and it gives a better healing rate as opposed to open surgeries. So that is something that we do it. Another thing which a lot of people don't know is a lot of arthroscopy is now being used by us in trauma cases also. So say, for example, fractures. So we use arthroscopy to treat intra-articular fractures, maybe of the tibia or maybe the wrist or someplace else where we can combine the open approach and the arthroscopic approach and give a better reduction, a faster recovery, and a faster, back to sports for a lot of these bad, nasty injuries.
Thank you so much, doctor, for that lovely answer about arthroscopies and trauma cases. I'm sure our audience would be so happy learning about all of these new things. So, something I found really interesting is that Dr. Modi comes from a family of doctors and has therefore grown up in medicine, which got me really curious. Seeing as you have gone from being a member of a family full of doctors to now an orthopedic surgeon yourself, could you tell us your perspective on how you have seen medicine really evolve?
How I've seen medicine get really evolve is things are a little easy but for us, but at the same time a little more difficult. So I'll just give you a short example. As when my dad started practicing, he did not have any investigations at his disposal to reach to a correct diagnosis. So there were no MRIs that time. The X-rays were not as easily available as they are right now. A lot, and he's a general surgeon, so sonographies and a lot of things were not, the standard uh, treatment. I mean, standard investigation that a person would do, which right now at this day and time, everyone just, does that even sometimes before seeing the patient. So he had to rely a lot on his clinical diagnosis. And right now, the newer surgeons like me and like other general surgeons have a lot of investigations as their backup to say maybe, um, reach to a diagnosis. That's how it's become a little easier. How it's become a little more difficult is that at that when he started practicing, there were not many surgeons who were, in and around him. So he was the front runner for a lot of things. Right now, when I have started practicing since the last 5 to 7 years, there is everyone who's, already doing that since a long time. So it becomes a little more difficult to say set up or, start afresh or, be the pioneer for something uh, nowadays. So that's how it's a little more difficult. But I mean, you can't complain if you're, in the field and doing good work. So that's all that counts at the end, I feel.
Yeah, no, that's definitely shed some light on things that I wouldn't even have considered. That's amazing. So now we know that medicine is a long journey, starting off from high school all the way to fellowship. Can you share a memorable moment from your career that stands out to you?
Oh, so a memorable moment. Just off the top of my head, I was appearing for my MS Orthopedics exam, and so I fared well during the whole. It was the Viva exam that I was giving. I fared well during the entire course of the exam, and you know we were almost done, and the external examiners were really happy as to how I was answering. And there came a point when he asked me a question and said that if you answer this question, I will give you a distinction. And I mean, he thought that it would be a very difficult question to answer, but fortunately, I had read about it and I did answer it, and he was so happy that he gave me a distinction. So that is something just that during the forming years of me being an orthopedic surgeon stuck with me. And also nowadays I'm doing a lot of work in shoulder arthroscopies. So I recently did a lower trapezius transfer, which very few surgeons do. So that is also something that I take back as one of the proud moments in my journey as an orthopedic surgeon.
It's so amazing to hear all of this about you, Dr. Rahul Modi. I feel like it's such an honor that Kiwi and I were both getting an opportunity to really talk to you. So, before we wrap up, could you please give advice to our younger audience that are going to be watching this interview?
Oh, wow. So I'm, uh, I'm not sure whether I should be happy that I'm giving advice to a younger audience because I consider myself very young eventually. But yeah, so something to, tell the younger audience who's just becoming a doctor is that there's a lot of negativity, which is that, there are long hours, people are, especially in India, the scenario is not very pleasant at the moment. Um, but the satisfaction that you get after diagnosing a patient correctly or treating a patient correctly, in my case, operating a successful surgery and getting that smile on that patient's face at the end of the day makes the whole journey worth it. So stick around. If you really like to become a doctor, there's no other field which will give you that level of satisfaction that being a doctor can give. So, stick around, be safe, and I feel, you will get rewards at the end. So it's still a very, very prestigious uh, thing to do. And I feel it's an honor that God has chosen us to be saviors to a lot of people that are suffering. So cherish that.
I'm sure our audience is going to be so happy with that advice. And with that, we conclude our very first interview here at Medlisys. We would like to thank Dr. Modi for joining us today and giving us time out of his busy schedule.
We would also like to thank
I'm honored to be here. Thank you.
We're happy to have you. We would also like to thank our viewers who continue supporting us on this new and exciting journey.
Thank you so much, Dr. Rahul.